Good morning, everyone. I'm San Francisco Mayor London Breed. I'm joined here today with the Director of the Department of Public Health, Dr. Grant Colfax, as well as the Director of the Department of Economic and Workforce Development to talk about the city's effort around COVID-19, what's happening with our reopening, and what you need to know. As of today, we have 4,020 new cases, total cases, 68 hospitalizations, and 13 transfers from other counties, and 50 people have sadly lost their lives to COVID-19 in San Francisco. I want to take this moment, first of all, to really thank the people of San Francisco, because we know that it is because of many people in this city, the fact that you have been wearing your mask, social distancing, washing your hands, and staying home in most cases, even though I know it has been challenging. Because you have done that, we have not seen San Francisco's numbers increase like some other cities that are experiencing significant challenge. But I also want to be clear that we are seeing an increase. Our numbers, along with numbers all over the country, are going up. And we are not out of the woods yet. I have said in the past, Dr. Colfax has said in the past, the COVID-19 virus, this COVID-19 is with us for at least anywhere between 12 to 18 months. And what we are trying to do is adapt to our new normal. And part of adapting to our new normal means that we not just want to keep ourselves safe, we want to keep the people around us safe. I can't express enough how important it is to wear your mask whenever possible, especially when you're around other people. It's not just about protecting you, it's about protecting them as well. And we, as you all know, are still having a number of challenges. And I want to talk a little bit today about our reopening efforts, because I know that that's really been at the top of everyone's mind, is what is happening. Last month, I made an announcement about a timeline, specifically when San Francisco was planning to reopen. And we were doing well in terms of our numbers. As we said, we will look at the data, we will look at what's happening in our city as it relates to hospitalizations and other information, and make decisions. So we moved up our timeline once the state provided us with a variance. We were planning to allow businesses to reopen as early as June 29th. And then something changed. We saw a spike, one that we have not seen in a very long time. And as a result, we had to put a pause on the opening of those businesses. And I know that it was very detrimental. Especially, it's already been financially challenging for so many hair salons and nail salons and a number of other businesses that were planning to reopen. And I know that this was very challenging, but this was definitely a matter of public health. So it's hard to make that decision to put a pause on reopening. And the original date before we were granted the variance was scheduled to be on July 13th. So I want to be clear that as of today, we must announce that on July 13th, we will not be able to allow restaurants to operate indoors as we had planned, nor will we be able to allow bars to open outdoors on July 13th. And we continue to evaluate the information and to make the decision. If we see the numbers stabilize or decline in any way, we will reevaluate that information and begin the process of determining what businesses can open. But unfortunately, with what we are seeing, and Dr. Colfax will talk a little bit more about the indicators and where we are, we have no choice. We are living in COVID, and I think what I want to reiterate is the fact that we are all in this together. What you do or what you don't do impacts someone else, whether you know it or not. And that's why it's so important that we follow the guidelines of the city to wear our masks, to socially distance, to wash our hands, to do everything we can to stay apart from one another during this time, especially as we see the numbers increase. I want to, at this time, introduce Dr. Grant Colfax, who will talk a little bit more about what's happening. And I also, as I said, Joaquin Torres is here because we know that, again, our small businesses in San Francisco who have already been struggling continue to struggle. We started a number of funds and a number of things to try and help support these businesses. I know it's not enough, but I want to be clear that, this is not a decision that we are approaching lightly. We know that in order to protect public health, we are creating other challenges for small businesses. We're creating other challenges because we know that over 153,000 San Franciscans have filed for unemployment. We don't make these decisions lightly. And this is why we want to reiterate how important it is for us to listen to the guidelines and to do our part. We need these numbers to go down. We need these numbers to go down. So we need not just people in San Francisco, but the folks who are also coming from other places to San Francisco, the people who are working in San Francisco, folks who work for our nonprofit agencies serving our homeless population are coming from cities all over the Bay Area, people who are working in our hospitals, our public safety officials. What impacts one impacts us all. So this is not just about San Francisco. This is about the entire Bay Area and our need to take this virus seriously and to all do our part to keep one another safe. And in San Francisco, as we see changes in the data, as soon as we are able to allow things to reopen, it will be at the top of our list. But we need to do so safely. So I thank you all so much for your cooperation, and at this time, I want to turn it over to Dr. Grant Colfax.
Well, thank you, Mayor. Good morning. I'm Dr. Grant Colfax, Director of Health for the City and County of San Francisco. I want to thank all San Franciscans for their sacrifices during this unprecedented time. The psychological, physical, and economic toll wrought by the pandemic are severe and continue to have major impacts across the city and region, particularly among communities already facing socioeconomic and health inequities. The virus has further exploited these fault lines. And so far, for the most part, we have managed to avoid the worst consequences of the virus and the pandemic. But that could change at any time. Today in San Francisco, we have 4,020 diagnosed cases of COVID-19, and unfortunately, 50 people have died of the disease. In the Bay Area region, there are over 30,000 cases and just over 600 deaths. In the state, nearly 250,000 cases and nearly 6,500 people have died. And nationally, we continue to see the pandemic surge with nearly 3 million cases and an astounding 130,000 deaths. Leading up to the holiday weekend, we did everything we could to make sure that we all knew the safest way to celebrate, and that was to stay home this year. For those who did go out, we asked collectively that people avoid gatherings whenever possible, wear face coverings, stay 6 feet apart, and wash their hands frequently. Over the weekend, the city handed out over 12,000 face masks to organizations in the Latinx community in recognition of the disproportionate burden of disease affecting the Latinx population. And we are continuing to expand low-barrier testing to communities most affected by COVID-19. And you may have received a phone call or text from the city encouraging you to do your part to keep the community healthy and safe. Unfortunately, there were still dozens of gatherings throughout the city, and many people were not wearing face coverings or masks. But I want to thank everyone who did take precautions. You are literally saving lives and keeping COVID-19 from spreading rapidly in the city. And I especially want to thank everyone who skipped the usual July 4th fun and made sacrifices this weekend. We are in a period, we have been in a period, and we continue to be in a period of uncertainty. And I want to acknowledge that this is a really hard place for all of us to be. And yet, we know what works, and we need to continue to do what works. We flattened, and some would say we crushed the curve once, and we can do it again. If we do not, the consequences could be dire. My commitment to you is that we will continue to follow the science, data, and facts. The results of the July 4th weekend behavior won't be known for at least 2 or 3 weeks, but we must continue to do all we can to flatten that curve again. Don't let your guard down. The virus is still out there, and there's more of it out there than ever before. It is spreading in our community and throughout the Bay Area region. We are working with scientists, researchers, who are seeing that the reproductive rate of the virus is climbing above 1. That means that for each person infected with the virus is infecting more than one person going forward. The virus is increasing in our community. At this rate, it could potentially overwhelm our healthcare system and cause many deaths if we don't get a handle on this right away. I want to make sure that San Franciscans, that you understand how serious and precarious our situation is. Let's look at our health indicators. They are publicly available and posted every day on the San Francisco Data Tracker that you can reach from the City or Department of Public Health website. I encourage everyone to keep up with these indicators and follow along with how the virus is impacting our community. The indicators are scored by color: green, yellow, orange, and red, to make it easier to understand where we stand. Today's indicators show that unfortunately we have reason to be concerned. Our case indicator is red. We are currently diagnosing on average 6.1 cases per 100,000 new cases per day. Our goal is to keep that number to 1.8. So rather than 1.8, we're at 6.1. That is red. That is a serious situation that requires us to pause. Hospitalizations for people diagnosed with COVID-19 have seen a 25% increase over the past week. Our goal is to keep that increase less than 10%. Our hospital capacity, fortunately, remains good. 35% of acute beds are available, and 30% of ICU beds are available for COVID-19 and other patients. But again, that could change at any time, and we know when this virus takes off, it takes off fast. Testing, we continue to expand testing. We're currently conducting an average of 1,762 tests over a 7-day average. Our contact tracing, we continue to follow up with 82%, reaching 82% of cases and 88% of their contacts. And our personal protective equipment, or PPE, is at 89% supply, status yellow. Now let's look at the Bay Area perspective. As we all know, San Francisco is not alone. We are part of an interdependent region where people live, work, go to school, and play across many counties at once. There are cases surging in counties across the region. For instance, Contra Costa has 1,375 cases now in just the past 2 weeks. They have been placed on the state watch list. Similarly, Marin, 1,774 cases in the past 2 weeks. They have been put on the state watch list. Solano, 616 cases in the last 2 weeks alone. They have been put on the state watch list. And we see similar numbers increasing across the region. This pandemic the virus does not know county lines, and we must respect that it is increasing across the Bay Area. So, where does that leave us? Our reopening is still on pause as of June 29th as we work to bring the latest surge of cases under control. We can do it. We've done it before, and it's up to us. I know that this is an unsettling situation, and there are a lot of unknowns. I know and appreciate that businesses are and need to be able to plan, and that residents need to get back to work. While it is so difficult, as the mayor alluded to slow down the reopening that we all want so badly, the price we pay for moving too quickly is extremely high. Remember, this virus has no timeline. Across the country, the virus is surging back in Florida, Arizona, and Texas. In California, and right across the bridge, the Golden Gate Bridge, Marin County is rolling back some of its reopening. And Imperial County to the south is overwhelmed with cases. Hospitals there are full, and patients are being transferred to other counties. In fact, here in San Francisco, we have 13 patients from other counties that we are caring for in our intensive care units. At this moment, we are not dialing back any of the businesses and activities that have already opened, but we are not going to rush it further ahead either. I know that it is confusing to keep track of all these lists and schedules, especially when they may change. Here are some of the public health principles that we are using. You can use them too to guide your decisions. Again, everyone in San Francisco, and indeed in the Bay Area, has a responsibility and an opportunity to protect the community's health. When you think about the risk of exposure and transmission, keep these things in mind. How risky is the activity? First, is the activity indoors or outdoors? Outdoors is much safer. Second, does it involve gatherings with people outside of your immediate household? That is riskier and should be avoided. 3, can you wear face coverings at all times during the activity? 4, can you maintain, and I mean can you really maintain, at least 6 feet of physical distancing? I think some of us have found that harder than we expect in certain situations. 5th, can you easily wash your hands, and is the environment properly cleaned? Think about any activity in terms of the following 4 characteristics: number, frequency, duration, and distance. Number: the more people who are together, the more interactions take place. This is riskier. Frequency: the more often people interact, the higher the risk of transmission. Duration: the longer the amount of time spent together, the higher risk of virus transmission. Distance: the closer together people are, the higher risk of virus transmission. Keep these principles in mind. Use common sense. Use our common sense. Facial coverings, social distancing. Think about the number, frequency, duration, and distance as you make decisions about how, when, and even if to engage. When we apply these principles and examine the health indicators and incorporate what we are learning about the virus and its reproductive rate in San Francisco and the region, we are forced to conclude that it will not be responsible to allow indoor dining or outdoor bars to begin on July 13th. Indoor dining is an activity where people typically gather with those outside of their households, take down their face mask, and spend time in close proximity. The simple pleasure of going to an indoor restaurant is something that we, and certainly I, all miss and enjoy. And restaurants are a vital part of our city's culture and economy. I know from experience what it means to wait tables and live by the service tips that are provided. But for now, unfortunately, indoor dining is an opportunity for the virus to spread. If we let that happen, it will further delay our chances of getting back sooner to the things we love to do. We are not alone. New York City also has put indoor dining on hold. And even West Virginia's governor has issued an order making indoor masks mandatory when social distancing isn't possible. They are taking aim at the same things we are. As for outdoor bars, they are currently restricted by the state for 23 counties on the watch list. And although San Francisco is not on that list today, that could change. As I said, several Bay Area counties are on the watch list. And if any county in the Bay Area is in such trouble, we are all in trouble. In keeping with our regional approach, we are going to abide by that restriction, since outdoor bars are an occasion for gathering, removing a facial mask, and can be a difficult environment to maintain adequate physical distance. Meanwhile, outdoor dining at restaurants and bars that serve food will continue to be allowed as long as everyone follows the precautions and the virus remains under control. We are continuing to evaluate the data and reconsider the reopening of indoor museums, zoos, aquariums, outdoor swimming pools, gyms, real estate open houses, and personal services. We will have an update on these activities by the end of the week. I can't emphasize enough how important it is that we do our part, that each of us does our part. Remember, even if you do not have symptoms, you could be carrying the virus, or your friend could be carrying the virus. Even though this virus has greatest consequences in general for people who are older, it can also have severe consequences for younger people. We must all do our part to keep as many people as possible from contracting the virus. Do not gather if possible, and not in large groups. Continue to stay home as much as possible. If you leave the house, wear a mask or face covering, stay 6 feet apart, and wash your hands. These actions save lives. We have time. There is a window now for course correction, but if we don't do it, and we don't do it quickly, we could be looking at a surge of illness that goes well beyond what we are prepared to handle. We saw in March that our rapid actions mattered. Just a few days made a huge difference. The power to make things better is indeed in our hands. We can get this right. We know what to do. We need to support each other in doing it. We can have a thriving economy in San Francisco with a healthy population and a renewed economy if we work together, remain vigilant, and hold our ground. Thank you. And it is my pleasure to introduce Joaquin Torres, the director of OEWD, who will make additional comments with regard to where we stand with the pandemic and business and recovery. Thank you.
Well, thank you very much for your leadership, Mayor Breed, and thank you very much for keeping us all safe and healthy during this time, Dr. Colfax. I know so many of the individuals within the business community, whether small businesses or their workers, are very, very happy that we are doing so much to keep them safe and healthy for the benefit of themselves, their businesses, and their families. We all know that these strong health practices are what are keeping us safe and allowing our economy to move forward in the way that it has to date. And I just want to say, for all of those small businesses, all of those businesses that have taken the innovative steps to work together and partner with the city to allow for activation to occur outside in safe, innovative, and healthy ways, thank you so, so much. We know that this is a very difficult time for you, for your employees, and for our city, but so much appreciate what you all have done for us to keep our city strong, lively, and our economic activity continuing. The issue for us right now around wanting to ensure that you have clarity is a commitment that our Office of Economic and Workforce Development brings. You please do visit our website at oewd.org to continue to learn more about updates that we are providing in partnership with the city and public health, so that you can have real-time information around best practices, guidance, and reach out to us so we can answer any questions that you may have about reopening. That is our commitment to you, in addition to continue to make you aware of the relief programs, whether grants or loans, that we are providing here in the city and county of San Francisco for all of you. We know that all of us are deeply excited about getting back to work. We know all of us are deeply excited about seeing when and how their business can reopen. Please do stay in contact with us. We look forward to working with you to making that happen. As Mayor Breed and Dr. Colfax said, the basics are what matter right now. Please do, when businesses are asking for your support, please be patient with them. Please continue to support them. They are looking out for your interests and our entire city's interests by asking you to wear your mask, maintain social distancing, use a sanitizer that they have at the front door when you come in. Please be respectful of that. They really do need, and we all need, your support in continuing our work to move forward for the benefit of all of us in our economy. So to all the residents, to the businesses, thank you so much, and to the workers who continue to come in and day out to make sure that they can provide for themselves and our families and all of us. Thank you so much for the work that you do. We look forward to continuing working with you. Please, again, do visit our website at oewd.org for up-to-date information, again, on guidance, when we can provide you details on reopening, and answer any questions that you may have, whether you're a worker, a nonprofit, or a business here in San Francisco. Thank you.
Director Torres, if you can stay at the podium, the first question will be for you. Okay, the first question is from Chris Reyes, ABC7. What can you tell the restaurant industry about the timelines for reopening and criteria for reopening? Are you working with the restaurant industry to set a new goal date for reopening?
The answer very quickly is yes. We are working very closely with the restaurant community. Our office and our staff are talking daily, if not every other hour, with industry leaders, both from the association perspective of the Golden Gate Restaurant Association and others, and also individual businesses. That's true across industries, across sectors, to make sure that we're up to date on information and needs that people have. As you heard Dr. Colfax mention, the realities right now are that we are not ready to provide a timeline in terms of when these next steps can be taken. This is contingent on what the data tells us. This is contingent on what all of us do here in San Francisco. We will know more, and we look forward to communicating more by the end of this week. But for restaurants and for the Golden Gate Restaurant Association and others, we will continue to work with you and provide you with up-to-date information.
Thank you, Director Torres. The next set of questions are for Dr. Grant Colfax, Department of Public Health. Dr. Colfax, your first question is from Marco Seiler Gonzalez, KQED News. Has there been an increase in the number of people from San Quentin who have been taken to San Francisco hospitals?
So the latest data we have is there are a total of 13 patients from San Quentin Hospital. From San Quentin in our hospitals across the city. That number has remained relatively stable over the past 7 days.
Related question from Kathy Novak, KCBS. How concerned are you about the outbreak at San Quentin and the effects that outbreak is having on the virus spread and hospitalizations in the Bay Area, including San Francisco?
Well, I'm certainly very concerned about the outbreak at San Quentin, and we are working with our state and local partners to coordinate efforts to ensure that people, both the inmates and the staff of San Quentin, are getting the best care and access to care possible. That is now being coordinated by the state. As I said in my overall comments, our hospital capacity overall in San Francisco is good. So as coordinated by the state, we will continue to support care for inmates and staff if necessary here in the city, and also supporting the regional and statewide effort to ensure that all inmates and staff get the care they need.
Follow-up from Kathy Novak. Do you think the crisis specifically is contributing to the delay in reopening?
I think that there are multiple factors contributing to the delay. I certainly can't draw a cause from the San Quentin outbreak to our decision here in San Francisco to delay. I do think that we are increasingly looking across the region, and as I said, if one county is in trouble, we are all in trouble. We're looking at both our local indicators here in San Francisco as well as indicators from our neighboring counties to make the decision that we did make to pause, and our indicators will continue to drive those decisions along with the context of what other counties are experiencing.
The next question is from Heather Knight, San Francisco Chronicle. San Francisco families with little kids are frustrated that playgrounds, the zoo, and aquariums, swimming pools, libraries, athletic fields, and likely schools aren't reopening. Do you have any thoughts on when kid-centered activities can restart?
Yeah, so I really appreciate the question, Heather, and I know how frustrated people are, and I feel for the kids and the families. And it's really this incredibly unprecedented, challenging time where we're trying to balance the need to protect children, their families, their grandparents, with the very issues that you're raising here. We have done a number of things that we hope will mitigate some of the concerns you raise. Camps are open with certain restrictions. We have child care guidelines out, and child care can open. The Slow Streets program closing JFK Drive, so families have more ability to get outside and exercise and get those kids out. And then we're looking and working with the school district and the private schools as well to potentially issue school guidance relatively soon. So still some uncertainty, still a lot of uncertainty, but really trying to balance the fact that kids need to get out, kids need exercise, their parents need a break, with the fact that we're in this unprecedented pandemic situation.
And the final question is from Felipe Dejagal from Cron 4. How close is the city and county from having to revert back to full-scale shelter-in-place ordered in March that eventually resulted in the curve of infections being flattened?
So we're not at that point today. We are not rolling back what we have opened at this point. We will continue to follow the indicators and see. Again, I am hopeful and I am even optimistic that if we all do our part, follow the guidelines, that we won't have to get to that point. Now, it's certainly it's possible, but I'm hopeful that we've done the right thing in San Francisco by following the data, science, and facts, moving congruent with the data. We'll be reviewing the data and indicators and decide on next steps by the end of this week.
Thank you, Dr. Colfax. This concludes our press conference for today.